Hi everyone, my name is Minal and I'll be presenting my poster on the effect of lumateperone on the amphetamine-induced disruption of blocking in the rat. Now, the blocking effect is a very well-established animal learning paradigm that measures selective processing, whereby prior association of stimulus A with an outcome blocks any sort of subsequent learning to stimulus B, when both stimulus A and B are presented together with the same outcome. However, blocking is actually disrupted in patients with schizophrenia. Unlike healthy controls whose learning about stimulus B is blocked by stimulus A, those with schizophrenia learn just as much about stimulus B as they do about stimulus A. Now, this inability to allocate processing resources efficiently leads to a malfunction coined aberrant salience, the tendency for irrelevant stimuli to be attributed motivational salience, attracting attention and influencing behavior inappropriately. Aberrant salience forms a central proposition of how many contemporary models of psychosis attempt to explain the positive symptoms of schizophrenia. Now, the dopamine hypothesis has been the leading theory explaining the pathophysiology of these positive symptoms. This dopaminergic dysregulation has been the focus of nearly all drugs used to treat schizophrenia since the discovery of the first antipsychotic nearly 70 years ago. However, the benefits of antipsychotic medications are sometimes obscured by their adverse side effects. These include relatively minor issues like dry mouth to very unpleasant, like constipation and weight gain, sometimes even life-threatening, things like myocarditis, which is actually the inflammation of the heart muscle. Now, lumateperone is a very novel agent currently being investigated for the treatment of schizophrenia, with its main mechanism of action being blocking dopamine D2 receptors. So it's essentially a D2 receptor antagonist. Unlike previous first and second generation treatments for schizophrenia, it's actually highly encouraging to see that it didn't appear to affect things like body weight, lipids, blood sugar, or involuntary movements, those side effects that we were talking about. Now, given that the difficulties that patients with schizophrenia exhibit in these selective attention tasks and how they form a large basis of the positive symptoms they experience, it's imperative that research focuses on how to rescue these deficits. It's been shown that administration of amphetamine at conditioning disrupted blocking. However, whether or not this amphetamine-induced disruption of blocking can be restored has not yet been explored. That too by an agent as novel as lumateperone. The present study seeks to investigate the potency of lumateperone as treatment for the positive symptoms of schizophrenia within the blocking paradigm. Specifically, whether the dopamine D2 antagonist lumateperone is capable of restoring blocking in amphetamine-treated rats using a standard foot shock fear conditioning procedure. Moving on to the method. Male Sprague-Dawley rats will be utilized in this between subjects design under standard housing, handling, and dietary protocols. The between subjects factor will be the drug group that the rat belongs to. After drug infusions, all rats will be subjected to a standard fear conditioning procedure where freezing in response to each stimulus, A and B, will be measured at test as an indicator of learning due to its efficiency, reproducibility, and well-defined neurobiology. Freezing, a species-specific defensive response to a danger-eliciting stimulus, is the most widely used measure of fear in rats. This immobile, crouching behavior is very easy to measure, whether that be via human observation or computer automation, and does not require invasive procedures. The drug groups are adapted from OT and Moran in a 2004 study, where both amphetamine and lumateperone are to be dissolved in 0.9% saline. All drugs are to be administered intraperitoneally in a volume of 2 mL per kg, as this has been shown to yield results in previous studies. It's an easy to master, quick technique that is minimally stressful for the animal and avoids the GI tract, unlike the oral route. Lumateperone or vehicle will be given to subjects 45 minutes prior to conditioning. Subjects will then receive either amphetamine or vehicle 15 minutes prior to the first conditioning trial. There will be 4 treatment conditions in total. Radio-labeled release from superfused brain slices will be used as a measure of dopamine release. The procedure will entail an acclimatization period where rats are placed in the conditioning chamber to freely explore with food and water readily available. Conditioning begins on day 10 with stimulus A, a tone, being paired with a mild foot shock. The next day, stimulus A and B, the tone and the light, are also paired together with a mild foot shock. At test on day 12, stimulus A and B, the tone and the light, are presented separately without the foot shock, and freezing behavior is measured in response to each. Moving on to the results. Now, we know that the vehicle group will show greater freezing to stimulus A than B, as this is the baseline Karman finding. Since data has indicated the disruptive effect of amphetamine on blocking, the vehicle amphetamine group will show similar rates of freezing to both stimulus A and B. Now, infusing a dopamine antagonist before conditioning has been shown to reduce the blocking effect. So the Lumateperone vehicle group will show relatively greater learning to stimulus B compared to other groups. Now, based on the finding that the D2 receptor is highly implicated in selective attention tasks, like the blocking paradigm, it is hypothesized that antagonizing its mechanism of action in the amphetamine-induced state will bring about freezing rates comparable to vehicle groups, thereby rescuing the exhibited blocking deficits. Now, the induction of an amphetamine state represents an established rodent model for schizophrenia. As such, investigating the effects of pharmacological agents holds great promise for the clinical translation of treatment for schizophrenia. If the results of the study align with what is expected and rats in the amphetamine group who are also given lumateperone exhibit a blocking effect comparable to that of those in the vehicle group, the capability of lumateperone as a treatment for schizophrenia is given greater empirical backing. This is of heightened clinical significance, as lumateperone has been shown to not cause the troublesome side effects that we discussed earlier, the ones that regular first and second generation treatments cause. It is promising to know that reduction in side effects greatly increases a patient's willingness to cooperate with treatment. Thank you for listening.